Irranca-Davies.
Minister, we have some absolute heroics going on in the care sector at the moment. Managers of care homes and frontline staff in domiciliary and residential care are going way beyond the call of duty. They're not just caring for our loved ones who are locked down and in isolation, but they're trying to adhere to physical distancing when working with residents with dementia and those who will wander. They're dealing with more frequent incidents of bereavement, and some care homes being especially impacted. And all of this being exacerbated by the difficulty of families and friends being isolated from the residents in life and in death. Our care workers are genuinely heroes. They always have been, of course, but it's now evident for all those who've not seen this before. So, Minister, what will the future look like for these heroes? When the public health battle against COVID-19 is won, will they be truly better valued in society? And crucially, Minister, will they be truly better paid and of better terms and conditions and a professional career path? And on a related note, Minister, what does a far more integrated health and social care effort look like in Wales in future times of comparative calm and peace, having learnt the lessons of how essential integrated working is in the heat of the battle against a pandemic?
Again, I think it's a really important point that Irranca-Davies makes about people who've been isolated in life and death, and it's very, very hard, both for people who know they're nearing the end of their life, but also their families who may not be able to see them and provide the sort of comfort and closure that for those of us who have suffered loss within our own family and friends understand makes a really big difference to being able to move on. In terms of the future for social care staff, whether in residential care or otherwise, I certainly haven't forgotten my commitments and the place where I want us to get as a nation. And I hope that the current crisis, the extraordinary time we're living through, means that people won't just wander out every Thursday to applaud key workers, not just in our National Health Service, but in social care and wider, and then forget about the conditions that they work under, the pay that they receive the month after the COVID-19 crisis is over. Because it does ask questions that we all need to answer about the sort of country we live in and how we value each other. Because we've really seen the enormous value that a number of people who are poorly paid provide to the way that we all expect to be able to live our lives, and frankly, the way we expect our relatives to be cared for in a way that other countries, for example, have much greater familiar care provision. That's what we don't have here. So I certainly want to see continued moves made forward on pay, on career progression, on terms and conditions. So the work that was paused on the ministerial group on paying for social care that at one point you were the chair of during a time in government, that has continued. It's been paused because we're about to publish a series of reports to start a national debate just before coronavirus became a much bigger issue. But I don't want to leave that work go. But I certainly hope that's not just a commitment from the parties in government, but much broader afield across each and every party about how we properly reward people and recognise them. And that recognition is in our integrated system. We're in a better place because we've made steps along the path of integration here in Wales. And I think far from undermining the plan in a healthy Wales for health and social care, it reinforces the need to make steps on that journey and to make them more quickly because they're at a better benefit, not only for our staff, but for the public that we serve.